You've got a lot of work ahead. I want to start on drug costs. The president put this 25% tariff on India, big drug producer. The president's trade deal with the EU puts a 15% tariff on imported medicines from Europe. How do you stop the drug makers from passing along those costs to people on Medicare and Medicaid?
Well, the president's letter on Thursday for most favored nation pricing is a good example of that. And he's been working on this tirelessly since the first administration. And just to put this in context for many of the viewers, about 2/3 of bankruptcies in America are caused by healthcare expenses. About 1/3 of people, when they go to the pharmacy, they leave empty-handed. They can't afford the medication. So the president has said, enough global freeloading. We've been covering much of the development costs for new drugs to cure cancer, deal with lots of other illnesses that are life-threatening. It isn't time for the American public to understand that we should not be paying 3 times more for the exact same medication in the same box, made in the same factory. So the president's saying, equalize it out. Let's use a model that's worked, for example, for external threats. That's what NATO did. Everyone has to pay a little more. We'll pay extra too, but we won't pay a lot more than everybody else. So they actually have to raise their contributions, in this case to an internal threat, which is illness. We'll pay a little less in America. That way more Americans can afford these medications, and it's a fair system for the entire globe.
So this was declared in these letters that were sent out to 17 pharmaceutical companies this past week, and it calls for extending that to Medicaid drug prices. Is that intended to offset what will be, cuts to Medicaid? And do you know, if the companies are actually going to follow through on this? Like, how do you actually strong arm them into doing it?
We'll just get the numbers correct. We're putting $200 billion more into Medicaid. So we're actually investing in Medicaid.
Costs are going up. So.
Costs are going up, but there's been a 50% increase in the cost of Medicaid over the last 5 years. So I'm trying to save this beautiful program, this noble effort to help folks, giving them a hand up. And as you probably gather, if Medicaid isn't able to take care of the people for whom it was designed, the young children, the dawn of their life, those at the twilight of their life, the seniors, and those who are disabled, living in the shadows, as Hubert Humphrey said, then we're not satisfying the fundamental obligation of a moral government. And this president has said over and over that he believes that it is the wise thing and the noble thing to help those who are vulnerable. And every great society does that. We're going to as well. So we're going to invest in Medicaid as is required, but we want an appropriate return on that investment. One thing that Medicaid patients should not face are drug prices they can't afford.
Right.
Then,
how do you enforce this?
Well, the pharmaceutical companies, if you sit them down quietly, Margaret, and we've done that, and say, you went into this business at some point because you cared about people. I know there's many out there shaking their heads, but that is actually the truth. People go into healthcare, whether they're pharmaceutical companies or insurance companies or the PBMs or anybody in the space. Even the CMS, the most impressive thing to me in my new task that the president has appointed me to is the remarkable quality of the people within the organization. Just unbelievably talented. They went into this job because they care about healthcare and about people. Somewhere along the lines, people forget. They put numbers ahead of patients. And when that happens, then you start running the problem. So we went to the pharmaceutical companies and we said, you appreciate this is not a fair system. We should not be paying more in America, 3 times more, for your products than you charge in Europe. They get the joke. They understand the reality of this problem. They are engaging with us. We're in the middle of those negotiations. The president has a unique power to convene. We've done it with dealing with prior authorization, this heinous process where patients feel like they're trying to get care from a doctor and everything's being done, except all of a sudden the arm of insurance comes in and stops the whole process for unknown reasons for weeks, sometimes months. The insurance companies representing 80% of the American public got together and they said, because we pushed them, we're going to deal with this. We can do the same, I believe, with the pharmaceutical industry with most favored nation pricing.